Okay, let's talk about the quality of food. Foods essentially start losing their nutrients from the moment that they're harvested. So they're best purchased fresh in appearance and in bright color. You should always check the date on processed foods, and anything should be used before the expiration date. Produce should be cooked until tender and thoroughly done in the smallest amount of water possible, again, saving those vitamins and minerals. Meat should be cooked via stir frying, steaming, microwave, or pressure cooking to save their nutritional value as well. The safety of food. The first thing for the safety of food is proper storage. Food should always be stored properly before and after purchase. This means that your packages and jars should be tightly sealed. Cans should not leak or bulge. Food that looks or smells unusual or shows any signs of mold or deterioration should be discarded. Hot food should be kept hot at 140 degrees or greater. Cold food cold at 40 degrees Fahrenheit or less. Foods that are standing at room temperature are a breeding ground for pathogens. Leftovers should be refrigerated immediately and should not be allowed to cool before refrigerating. Proper sanitation means that all cooking utensils, pots, pans, cutting boards, as well as the hands, have been washed with soap and water before preparation begins. And you should do the same thing to prevent cross contamination. Before you move from one food to another, you wash all the utensils, including the cutting board and your hands, with the hot water and soap as well. Anyone who is ill should not be allowed to prepare food. You should practice good hand hygiene following bathroom use as well. Meat, fish, and poultry should be rinsed under cold water and patted dry with paper towels before preparing and cooking. And then you should add a capful of chlorine bleach to a sink half full of water to wash fruits and vegetables in. Then you're going to rinse them in water and drain them on paper towels. Foodborne illnesses occur when there's improper storage, sanitation, or cooking is not as done. They range from mild, such as a staphylococcal food poisoning, to potentially fatal, such as botulism or E. coli. Foodborne illnesses are highly preventable when you handle, prep, and store food appropriately. So you have to remember those things. So when you're doing a nutritional assessment of your patient, you can use what's called the 24-hour recall, in which the client identifies everything consumed for the previous 24 hours. It's performed easily and quickly. You ask the right questions. They may not always be able to accurately recall it. So a lot of times you have them come back and you do it. They write down everything that they consume. You have the food frequency questionnaire, which gathers data relative to the number of times per week, day, or month the client eats a particular foods. You can tailor those questions about particular nutrients such as cholesterol and saturated fat. You can also do a food record or a diet history. You have to remember that when you're doing a nutritional history, that food preferences are often an expression of an individual's likes and dislikes. They can be related to food texture, how it's prepared, or what was served to the individual during childhood. They also can be an expression of their economic, ecological, ethical, and religious beliefs also. Um, Peer pressure often dictates to teenagers what they eat. Stress, depression, and alcohol abuse alter the appetite, and sometimes medications can alter food absorption and excretion and affect the taste. And then gastrointestinal disorders such as anorexia, nausea, vomiting, diarrhea, constipation, discomfort, and pain also alter eating habits and food preferences. So we're going to move on to diet therapy. So your NPO diet is nothing by mouth. It's often prescribed before surgery with certain diagnostic procedures to rest the GI tract, and sometimes when the client's nutritional problem has not been identified yet. So a regular diet is planned according to the food pyramid. There are no restrictions of any kind, and usually it's about 2,000 kilocalories per day. A soft diet are foods that are easy to chew and swallow. A soft diet then promotes mechanical digestion of foods. You have to avoid nuts, seeds, or anything with seeds such as tomatoes and berries, raw fruits and vegetables, fried foods, and whole grains on a soft diet. A clear liquid diet is also called a surgical liquid diet. It's ordered in preparation for a diagnostic test or as the first meal or two after surgery. It consists mostly of water and carbs that gives about 500 kilocalories a day. It is nutritionally inadequate, but it does relieve thirst, aids in hydration, and mildly stimulates peristalsis. Liquids that can be included are basically anything that you can see through: water, clear, fat free broth, tea, coffee, strained fruit juices, jello, popsicles, carbonated water, drinks such as lemon lime soda. A full liquid diet provides about 800 to 1,000 kilocalories per day, and it's anything that is liquid at room temperature. It includes everything in the clear liquid diet, plus milk, milk drinks, cream soups, strained cooked cereals, ice cream puddings, fruit and vegetable juices, and custards. A mechanical soft is a diet that consists of food fixed especially for a person who has no teeth or has difficulty chewing. It's either ground or chopped into very small pieces and cooked very soft to ease the work of chewing. Pureed means that they have blended the foods to a smooth consistency, also for a person that has difficulty swallowing. A low residue diet is a diet that has 5 to 10 grams of fiber a day that reduces the work of the intestines by reducing food residue. These diets limit tough or coarse meats, milk, and milk products. It's prescribed to decrease GI mucosal irritation for diverticulitis, ulcerative colitis, and Crohn's disease. Foods to be avoided also include raw fruits, except bananas, vegetables, seeds, plant fibers, and whole grains. Dairy products are limited to just 1 or 2 a day. A high fiber diet, on the other hand, is 25 to 35 grams or more of dietary fiber. It's an integral part of treatment for diverticulosis because it increases the forward motion of the indigestible waste in the colon. It prevents constipation, hemorrhoids, and colon cancer, along with helping treat diabetes and atherosclerosis. These diets recommend coarse and whole grain breads and cereals, brands, fruits, and vegetables, especially raw vegetables and legumes. 8 8-ounce glasses of water must be consumed also a day. A fat-controlled diet reduces the amount of fat by replacing saturated fats with monounsaturated fats and polyunsaturated fats, and restricts cholesterol. It's used for clients with atherosclerosis, heart disease, and obesity. The saturated fats to be avoided are animal fats, gravies, sauces, chocolate, and whole milk products. This is sometimes part of a cardiac diet. A cardiac diet will include the fat-controlled diet and the sodium-restricted diet as well, because they cannot have the sodium either. A sodium-restricted diet is tailored to meet the level of sodium to mild, moderate, or severe. It's for clients who have fluid volume excess, because what happens? Where sodium goes, water goes. Hypertension, heart failure, MIs, or renal failure. See what else do we? Thickened liquids. For thickened liquids, you must know whether they're honey thick or nectar thick. There's a difference in the consistency of liquids in that case. Diabetic diets have a calorie restriction, usually 1,800 calories, and they do not have simple carbs. They have complex carbs, and they have no concentrated sweets added to them. They get no sugars, if at all possible, unless it's natural sugars from fruits. Renal diets limit the amount of protein and the amount of phosphorus and the amount of sodium in them. I think that covers all of our diets. Now we're just going to talk briefly about some of the assistance with meals tips. You should not remove a tray in front of the patient. You should do it on the bedside table before you put the tray in front of them. Some people, especially if they're experiencing a little bit of nausea, when you take the cover off of the plate of food, the aroma is so strong and hits them so hard that it will cause excessive nausea and sometimes vomiting as well. So before you put that bedside table next to that person, take the cover off of the tray then, and let it, some of the odor come out into the air before you put it in front of them. Also, You need to make sure when you're preparing a client for a meal that their face and hands are washed, that they've had oral hygiene, that their teeth have been put in if that's necessary, and that they've emptied their bladder. Make sure that they're in a comfortable position also, and that they should be sitting up. When you prepare the environment, make sure that it's conducive to a pleasant mealtime also, that there's cleaning and clearing of the overhead table so that the tray can be put there, that the room is tidied to remove any offensive sights or smells, and you might want to also open the shades to brighten the room a little bit. When you're serving the tray, make sure it's the appropriate diet, that nothing has spilled. If they have a low sodium diet, that there's no salt on there, no additional salt. If they're a diabetic diet, that they don't have packages of sugar, that they have sweet and low or equal instead. That you have the correct tray, and open their packages for them. Remove the saran wraps. Open their utensils. Cut their meat or add their sweet and low or their sugar or whatever the case may be. Make sure that they are able to do to feed themselves, but prepare that tray for them. Set it up for them. If they need assistance with it, help them with it. Allow them time for prayer if they want to. Make sure that they have a napkin. Allow them to chew. Don't rush them. Make sure that they're bite-sized portions, that it's appropriate. Warn them about hot foods, but please do not blow on their food. Use a separate straw for each liquid. If possible, let them choose the order that they eat, and offer pleasant conversation. You expect all of those things when you eat your meal, so you should be able to give those things to your client as well. If your client is visually impaired, you need to prepare their plate like a clock. So they're looking at the clock, and you're going to describe to them where each food is. At 12 o'clock, you have so-and-so. At 3 o'clock, you have this. At 6 o'clock, you have this. Whatever the case may be. So that they know what they're eating. Some people have a particular way that they want their tray turned. They want the meat, at the 8 o'clock position or something like that. And then they have something that designates to them also where each glass should be. They have like a mat on their bedside table that tells them how their tray should be set up. So you should be respectful of that if it's already laid out for them. Make sure that they also have straws or appropriate cups so that they do not spill their liquids when they're drinking them either. And I think that will wrap up everything that there is on nutrition.